Welcome to a snapshot of Adaptiiv's Modulated Electron Bolus, or MEB module. Like all modules in our software, the MEB module is a turnkey in-house solution. It has regulatory approval with FDA 510(k) clearance and is fully validated for use in radiation oncology. It integrates directly with the clinically commissioned TPS used by your center and reduces risk by verifying the patient-specific accessory against a plan created prior to printing. Electron therapy has many benefits. However, typical treatments do not allow users to conform dose, so most centers can't modulate the range of electron beams. As seen here, the red dashed line represents a prescription isodose line with a uniform thickness bolus. Therapists often need to manually create a modulated accessory that can tailor the prescribed dose to the tumor volume. This does not guarantee an optimal dose distribution to the PTV and requires highly skilled labor. So, Adaptiiv developed the MEB module, enabling users to produce an optimized bolus structure that modulates the prescribed dose to follow the exact contours of the tumor volume. An excellent example of the benefits of using modulated electron bolus can be seen in the following patient case study. This case involves an adult patient with mycosis fungoides of the scalp. The original plan is clearly unacceptable due to the dose received by healthy tissue, the brain in this case, and the notable hotspots. Adaptiiv's algorithms optimized the bolus created in the TPS, which changed the surface shape and tailored the 90% isodose to follow the contours of the PTV while sparing critical organs at risk. Adaptiiv's MEB module enables users to automate the fabrication of bolus structures. A ray tracing algorithm measures the distance from the distal edge of the PTV to the prescription isodose and thickens the bolus accordingly, shaping the isodose to conform along the PTV while sparing healthy tissue below. As seen in the left column, the MEB plan is superior to the VMAP plan seen in the right column. Comparisons of both plans illustrate the significant sparing of healthy tissue at various prescription isodose levels. In this case, 90%, 50%, and 30%. Now we'll show you a demo of our software where we'll recreate this electron scalp case. To begin, select the Modulated Electron Bolus module. Once open, users can import patient information from the treatment planning system into our software. Our software uses the TPS to gather the necessary patient DICOM data that is required. The bolus created using the TPS for the scalp can be viewed in the top right window. Users can select this view and zoom in for a closer look. To optimize the bolus for use with electrons, the user must select the necessary structures that have been imported from the TPS. These structures include the bolus, the PTV, and the prescribed isodose level. Next, users will select Start Optimization. Clicking this button activates Adaptiiv's ray tracing algorithm. This proprietary technology measures the distance between the distal part of the PTV and the prescription isodose. It then alters the thickness of the bolus along that ray. Now the bolus has been modulated and optimized. Additional post-processing tools are available, such as cropping, cleaving, patient ID labeling, or adding dosimeter pockets that can be printed directly into the bolus. Once completed, users can export the RT structure and bring the plan back into the TPS for verification. This allows users to link the bolus to the plan so they can confirm they are satisfied with it prior to 3D printing. Once the plan has been verified and validated in the TPS, if any hotspots are discovered, users can identify those and bring the structure back into our software, use the hotspot correction tool to re-optimize the modulation to a point where hotspots are reduced to a clinically acceptable level. Thank you for watching a snapshot of our software in action. For a full demo or to receive a quote, please click on one of the links provided below.